So we used to think that moderate drinking was beneficial in terms of reducing our risk of heart disease. Now, we've always known that alcohol is a carcinogen. I mean, that's undisputed. Right? Alcohol causes cancer because alcohol is metabolized something called acetaldehyde, which is a known human carcinogen. Increases the risk of over a dozen different cancers. So including like breast cancer, even very light drinking, like less than a drink a day, increases your risk of breast cancer because it's a carcinogen. But cancer, killer number 2. What's killer number 1 for women? Heart disease. So because we thought moderate drinking, few drinks a week, actually was beneficial from a heart disease standpoint, we would assume that overall it would be beneficial. And indeed, the moderate drinkers, lived longer lives than the teetotalers drinking 0 drinks a day. So we came up with what's called a J curve, where the lowest mortality, so this is mortality versus alcohol. And so the lowest mortality, so it wasn't like this with less mortality with less alcohol. It was this J curve where their mortality actually went up with the teetotalers drinking 0 drinks a day. So that's where we got all this confusion until they realized that, and this is only recently, last few years, we realized that there was a systemic, this was an artifact, this J curve, was an artifact of the systemic misclassification of former drinkers as if they were lifelong abstainers. In other words, this is what's called the sick quitter effect. So when they ask people how much you drink, they say, I don't drink at all. They think, oh, well, you're a teetotaler, right? Right? Okay, but did they just stop last Tuesday because they got liver cirrhosis, right? That the reason they're not drinking is because drinking made them sick. So there are studies showing that people who quit smoking, right, live shorter lives than people who continue to smoke. How does that make any sense? Because of the sick quitter effect. Why did they quit smoking? It's really hard to quit smoking. You really had to be something for you to quit. Why did they quit smoking? Because they got a lung cancer diagnosis. Of course, the only reason they're not smoking right now is because they got lung cancer. They got emphysema. They can't breathe anymore. So, of course, they live shorter lives, the non-smokers. So you can't be like, do you smoke? They have to be like, have you ever smoked, right? When did you stop smoking? Okay. So if you go back and for example, there are studies showing that non-drinkers have higher rates of liver cirrhosis than drinkers. How does that make any sense? Why are they non-drinkers? Because they got liver cirrhosis. It's this reverse causation. Okay, so if you go back and you take this huge body of evidence and you eliminate this artifact, this systemic misclassification of former drinkers as if they were lifelong non-drinkers, if you get rid of that and you just look at people who actually don't drink, then J-curve disappears. And it's this straight linear line where there's more death, more disease for more alcohol consumption with 0 protection at lower at lower levels of consumption. And so that's why now the World Health Organization, the World Heart Federation, Global Burden of Disease Study, etc., say the only safe level of drinking is none.
Hey there, vegan family. Thank you so much for watching our video clip. If you liked it, please give it a thumbs up, hit subscribe, tell all your family and friends. We really want to help this channel grow, so that would be amazing. And also, if you really, really liked it and you'd like to purchase the entire video, you can head to the link in our description box below and you can purchase this video or get the collection from the cruise. So thanks again for watching. Hope you're having a beautiful day, and also hope we get to see you aboard the ship very soon. Aloha. Whoop, 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 whoop.